This tutorial is to provide a brief summary of the clinical considerations and general parameters used for electrical stimulation in physical therapy. We're going to start by talking about E-stim when it's used for pain control. And primarily we see E-stim for pain control delivered in one of two ways, either using TENS, which is known as transcutaneous electrical nerve stimulation, or via interferential current, or IFC. Now, regardless of whether you use TENS or IFC, the treatment is basically delivered using the same frequencies, and the pain control is achieved through the same sort of three pathways. And this depends on whether the patient is in more chronic pain, subacute, or acute pain. So if the patient is in more chronic pain, we want to deliver a noxious level TENS or IFC. And in noxious level TENS, the frequency is low, so we look at 1 to 10 pulses per second. And this is thought to stimulate the small C fibers, the fibers that carry pain information. So this might be a little bit more uncomfortable for the patient, but stimulating those C fibers is thought to provide some pain relief through the release of endorphins. If the patient's in a more subacute phase of healing, we may use a motor level TENS, or what's also sometimes known as low frequency TENS. This type of pain control may also be delivered through high volt or Russian current, although we typically think of those two types of current as more truly for muscle contraction, for re-education and strengthening. We can utilize those currents for motor level TENS. And when we provide motor level TENS, our frequency is in the 20 to 70 pulses per second range, which is the frequency which stimulates the motor fibers and therefore modulates pain via descending pathways. Finally, what we think of as kind of conventional TENS is also known as sensory TENS, which is for patients that are in need of more acute pain control. And so your frequency is set at 100 to 105 to 150, or 125 to 150 pulses per second. This is obviously a much higher frequency, thought to stimulate the larger afferent sensory fibers, which then close the gate on that pain, on those pain fibers, or inhibit those pain fibers. So this is a kind of a quicker acting, but maybe a shorter acting form of pain control, and it's for patients who are in the acute phase. Now, if we want to use E-stim for muscle contraction, as I already mentioned, there is a motor level TENS that can be used for pain control. But we also sometimes want to use E-stim to actually contract the muscle, get a good muscle contraction from re-education, strengthening, or muscle pumping to get rid of swelling and fluid. And oftentimes we use the term NMES, or neuromuscular electrical stimulation, for this. Some machines may use the terminology high volt or Russian, but even the machines that say NMES are usually using a Russian type current. So when we think of Russian or high volt, those can be used for sensory relief, but are more often used in pain control. And Russian is probably the most common, and what you most commonly see in just kind of more generic NMES units. If we want muscle re-education, we want to be in the 35 to 55 pulses per second range. So that's enough to get that good motor contraction, but not high enough for tetany. The on-off range may range from, the on-off ratio may range from 1 to 1 to 1 to 4 or more. But basically you're going to want to have the patient have the contraction for a certain amount of time and then a rest for a certain amount of time. So depending on the ratio is sort of up to the patient's comfort tolerance, may be limited by their fatigue and really what your goals are. And this type of treatment usually lasts for about 10 to 15 minutes before the patient gets fatigued or just sort of bored with the treatment. If you want to use E-stim for muscle strengthening, you want the contraction to be stronger. You want the pulses per second to be higher, so you start to get to the range of tetany. And because you're doing a much stronger contraction and you're in that range of tetany, you're probably going to want to have a fairly high on-off ratio. So for example, you might have 5 to 10 seconds on, but up to 50, up to 120 seconds off. During this application, you're going to encourage the patient to contract with the machine. You may apply some resistance. And like with a lot of muscle strengthening, A very common dosage for this is 3 sets of 10 contractions, although again, that can be arranged depending on what you're trying to get. If you want to use E-stim for muscle contraction to get a muscle pumping effect, to get rid of fluid and swelling and edema, we're going to be back in that kind of 35 to 55 pulses per second range, again, lower than what is tetany. We don't want a tetanic contraction for this. Our on-off ratio is going to be about 1 to 1, and they're going to both be relatively short, so about 5 to 10 seconds on, 5 to 10 seconds off. The intensity here is going to be a bit lower because you're not trying to produce that really strong contraction to get a lot of recruitment or a lot of strengthening. So the patient's probably going to be able to tolerate this longer. You're just kind of trying to get a nice contraction to get that fluid out. So you may leave this on for 20 to 30 minutes. Oftentimes pulse duration is set by the manufacturer and can't be changed on a machine, but if you can change the pulse duration or the pulse width, what you want to do is, whether you're delivering E-stim for sensory or for pain control or a muscle contraction, you're going to want to set the pulse width based on the type of fibers you want to stimulate. So for a motor response, whether it's motor level 10s or it's muscular re-education, strengthening, or pumping, you're going to kind of want to be in that 300 to 600 microsecond range. It takes a shorter pulse to stimulate sensory fibers, so 75 to 150 microseconds may be appropriate for that sensory level 10s. And then for noxious level 10s, or if you're trying to stimulate those C fibers, you're going to need a longer pulse duration or pulse width, which is going to be up to 1,000 microseconds. Just a general word on intensity. For the most part, when you're providing E-stim for pain control, you're going to want the intensity to be set as high as possible to the patient's tolerance. For muscle contraction and strengthening, it depends on what you're wanting to achieve. Obviously, for strengthening, you want a very strong contraction. For edema control and muscle pumping, it may be less of a contraction. This is from your book and basically gives you a sort of a general range of milliamps and how that might feel to a patient. Iontophoresis is sort of the final broad category of E-stim that we talked about, and this one's pretty straightforward. For iontophoresis, you get a prescription for a medication. Oftentimes in physical therapy, that medication is to control inflammation. The medication is going to have either a positive or negative polarity, and then you're going to want to make sure you apply that medication to an active electrode that has the same polarity. So on a standard iontophoresis unit, you're going to apply the solution to the electrode and then attach the lead wire to the electrode that is the same polarity as the solution. On some of the newer machines where there's not a separate machine where you attach, there's not separate wires you attach, the electrodes themselves are going to be labeled as positive or negative. So you'll just put the solution on that appropriate electrode. But again, you want the active electrode to have the same polarity as the medication. Iontophoresis uses direct current delivered continuously to kind of drive the electrons all the same direction to move that medication into the tissues, and it's dosed in milliamp minutes. So for our standard machines, it's a pretty simple calculation. You just multiply. So if a doctor prescribes 40 milliamp minutes, you may apply that treatment at 4 milliamps for 10 minutes to get your 40 milliamp minutes, or 2 milliamps for 20 minutes. Some of the newer machines use different sort of algorithms and ways of delivering medication, so it's important to know your machine and know that some of those machines may require a much longer time in order to deliver that same dosage. And finally, just a couple of words about current density, which really applies to all of these types of electrical modalities. In general, the closer together you space the electrodes, the more superficial your current density. Further apart gets the current density deeper. So again, this is extremely applicable for iontophoresis. When you place the electrodes closer together, you may have a more superficial current density and therefore be a higher risk for burns. Electrode size is a consideration. Larger electrodes spread out the current, decrease the densities, whereas smaller electrodes concentrate the current. So again, depending on what you want, you may have electrodes of different sizes. And then on page 113 of your book, there's a nice discussion of electrode placement. A lot of the kind of 10s are going to be a bipolar placement. IFC is quadrupolar. NMES, or for muscular contraction, sort of depends on how many muscles you want to stimulate, but usually bipolar or quadrupolar, and iontophoresis is monopolar. And then I just wanted to end by just reminding you that no matter what type of electrical current you're thinking you're going to administer, or what sort of case is thrown your way, the process of decision making is really the same. You want to know what phase of healing your patient is in and what you want to do. Are you wanting to control pain? Are you wanting to control inflammation? Are you wanting to control swelling? Are you wanting to get some muscle contraction? It's critical that you know indications and contraindications, because no matter whether or not you feel that electrical stimulation would be great for your goal and the patient's phase of healing, if it's a contraindication, you're going to have to find another type of treatment. Once you've determined that the patient does not have contraindications, you know what you want to do, and you understand their phase of healing, then you can make the best decision about the mode of delivery, also known as the type of waveform you're going to use. So are you going to use TENS, interferential, NMES, or ionto? And then you're going to consider all of these things I've just talked about in this tutorial, as well as some things I've outlined in another tutorial in order to set up your parameters, including thinking about electrode placement, frequency, intensity, pulse duration, and IFC. Do you want to use sweep? In TENS, do you want to use modulation? For motor application, you're going to have to think about on-off time and ramp time, and for all of the applications, treatment duration.